He's a group CEO of AmRef Africa. Doctor, thanks so much for joining us. And I'm sure in fact, the first question is, how are you holding up, Doctor? How are you doing?
I'm doing well because this is, we are many of us, we are the entire nation trying to fight these wars. So it's not a one-person show. The ministry is doing what they can. We are doing what we can as advising and supporting communities as we are. So it's not one person. So we are holding together. And the more we work on this together, the more we are going to succeed.
Now, you tweeted today that most of the infections, at least more than 50%, are in quarantine, which appears to be a good thing. From the trend that you've observed so far in terms of how the infections are moving, are quarantine the biggest problem right now?
I wouldn't say so. I would say that obviously, statistically, we can say that about half the number of the positive cases we have are in quarantine. But you must also remember that that's a population that was high risk. It was traveling in from countries that already had the COVID-19. And therefore, the sample itself is biased because you have this sample of people who traveled in. We know that traveling in or traveling from a country that had it is high risk. Whereas we are looking at the other half coming from a general population that was largely low risk. So I think the high concentration in quarantines is expected, I would say. But it also points to the importance of the decision to mandatorily quarantine those people, because it means that there were many people who had already had contact with the virus and therefore would have put the communities at risk as well. So it was a good decision to do the mandatory quarantine.
Okay, here's an unfair question, Doctor, but I have to ask it because I'm sure everyone has a friend who knows a friend who has a friend who is in quarantine right now. My good friend Stephen, Lydia Nyabu, I have a son who was outside the country, came back, was told 14 days at a certain place. After 14 days, they were told, this kid has to stay for another 14 days. There's an Asian lady who posted a video online. I'm sure you've seen that. A young lady crying her heart out, talking about the horrible conditions in quarantine. Daktari, I mean, when will this madness end?
Jeff, it breaks my heart to see those situations happen. It breaks my heart to see people suffer. I've seen young people post videos, when they are in there in quarantine and suffering. So it breaks my heart. And the suffering will take us all together. And I think the thing is about how we support each other, because at the end of the day, the decisions that are being made have to do with how best to flatten the curve, how best to protect communities. So people will suffer. And I think even for those who held in for the 14 days, even before the addition, it's not easy. We have families that came to visit their families, but they can't see them for those 14 days. So I think what we need to look at is how do we all in solidarity understand the decisions? Because I've had people call me and say, do we have to stay another 14 days? But when you think about it, what the government was worried about, because I listened to the address carefully, is that within these 14 days, we were, the testing was done, but then we found, there was a high concentration of positive cases. As I say, it is more than half of what we have. So it's probably close to 60 something now, maybe close to 70. But there is a fear that some of these 70 could then have been in contact with part of the other people who are in quarantine, and therefore there is a risk that some of them could have been exposed, but they haven't shown symptoms yet, and they haven't been tested yet. So even testing them now and finding negative, you still need to give them a few days. As to how long we do that, the government has said is 14 days. Whether it may be shorter or not, I don't know. We'll leave that to government. But it breaks my heart. But these are measures that we are having to take across the world to make sure that we can flatten the curve and we can stop transmission to others. So at any one time, think about yourself, but think about the others as well, is what I would say.
And let's talk about transmission. There was a report that came out this week saying that it can be transmitted through breathing and just talking now. And I wonder if that has now informed the new directives for everyone to wear masks in public. Initially, we were told this is just for caregivers or people who may be sick. Now we're being told that you must wear a mask in public.
Yeah, this issue of masks is a bit heated, and I think as we must always remember that this has taken only 4 months for us to understand the transmission of this virus, how it behaves in the human body, in the air, on surfaces. What I would like to say about the masks is that actually the act of wearing masks is for protecting and preventing transmission. That's largely what it is for. We know that the virus doesn't last long enough in the air. It doesn't last for very long up in the air. But we know that if you're next to somebody who is coughing or sneezing or talking to you, and as you know, sometimes when you're talking or sneezing and coughing, you may emit aerosols, what we call aerosols, small particles of saliva which may contain the virus. And those particles can do two things. They can either land on someone's, in someone's mouth or nose or eyes, in which case then it's transmitted, or it can float in the air for some time and then land on a surface. When it lands on a surface, then we touch it with our hands, and then our hands become the next transmission agent. So when we ask people to wear masks in public transport, public places, supermarkets, it's most importantly to stop shedding of the virus from them onto surfaces, which then put other people at risk. So that's the most important thing. Number two is for you to protect yourself in case you are near somebody within the distance of 1 meter or so who is coughing or sneezing and could transmit the virus directly to you through the aerosols. These are the main thing. It's not because the virus is found lingering in the air generally. It is to stop shedding of viruses and to stop the risk when you're talking to somebody directly and the aerosols could land in your mouth or on your nose.
And just to follow up to that, because for those who don't have access to masks or maybe have trouble breathing when they do wear masks, are there alternatives?
Well, there are no alternatives to this. I think what we've said is that we have said the first thing we must remember, and I would like to emphasize this, is that masks are not the only preventative measure for COVID-19. And in fact, we've had worries for people thinking that because they're wearing a mask, they get a false sense of security. We must remember that the most important agents of transmission is our hands. So we have to wash hands with soap. Whether you're wearing a mask or not, you must wash your hands with running water and soap. You must practice cough hygiene. You must you must stay at home if you can, and you must, as we are saying, social distancing. These elements of prevention are critically important, irrespective of whether you're wearing a mask or not. So if we all observe hand hygiene, cough hygiene, stay at home if we can, the mask is just an additional way. So meaning that even if you don't have a mask, it doesn't mean now that you are at risk more than somebody who has a mask. It's just that when we wear masks, it stops the shedding of virus and therefore reduces transmission. But hand hygiene, social distancing remain the primary methods of controlling transmission.
Dr. let me ask you a complicated question. Is this virus metamorphosizing, if for lack of a better word? Because when you hear of 1,000 deaths in New York City every day, 800-900 deaths in Italy, I mean, is that virus different over there than it is over here?
Well, the virus, we know that the virus has been mutating. We know that. We know that there are different strains already, and it's a bit complicated to explain it, but we know there are different strains. But the virus is largely the same. It is actually largely the same. It hasn't changed its mode of transmission. It is still the same, as we've talked about. It hasn't changed the organs of effect. And we know that it is landing on the lungs and creating a viral pneumonia. And we know that the profiles are the same, that when it causes this pneumonia, what happens is that it overwhelms the lungs with fluid, and this fluid is what stops the breathing. And therefore, the most important thing is, how do you, if you remember, I think I've talked about this before, that one is you have to prevent transmission. That's what we spent the last few minutes talking about. Then you have to prevent death. For you to prevent death, you need to focus on ensuring that you stop elderly people from being infected, which is why the policy on urban-rural migration was mentioned by the minister. Secondly, that for those infected, you identify them early. So testing is critical because you identify the people infected early. Isolating is critical because then they are where they can be observed and they can be treated. And finally, that you can actually treat the people, meaning that you can take care of the symptoms and help the lungs to breathe. That is the ventilator and ICU environment. The problem with Italy is that the health system got overwhelmed, and therefore you have people having to make a choice who gets a ventilator and who doesn't. And the problem with the US is the same, that US has a very privately driven healthcare system, and that privately driven healthcare system means that majority of the people who may be infected and who may need care may not access it because they have to pay out of pocket, which is why we reiterate that this virus is not this effect or the response we are having should not be just limited to the virus. We must also ask about how do we provide social health insurance to everyone, which takes us back to the conversation on universal health coverage, health access to all without financial difficulty. That is what you're experiencing in the USA.
And, let's cross over to the frontliners. This is a concern because we've seen quite a few of them affected. A question here from Twitter, John G asking, all health workers are at risk of COVID-19 infections now that we are in the local transmission phase. How well have they been sensitized, protected to avoid situations where they're being quarantined or worse, infected? Do we have enough PPEs?
So the first thing to say is that health workers there have been a big effort in Kenya and across other countries to sensitize health workers, training community health workers. AMREF is working on this in Kenya, but also in many of our countries where we operate in Africa. Training, critical care nurses, doctors, port health people who are dealing with patients, and people who are working in hospitals. That is all being done. But as we always say, you might have a plan until you get punched in the face. I think it's Tyson who said this. And when it actually happens, the practice itself requires to be perfected. So people need to be always alert that the patient you're dealing with could be a COVID-19 patient. But beyond that, we have to make sure that health workers have protective equipment. These are masks, goggles for their eyes in case they're having to meet patients who are active, body suits that cover their head as well, gumboots, and there's a big shortage across the world. There has been a big shortage, and the shortage was created obviously by global demand is number one. Secondly, the fact that borders were closed for a long time and the supply chain was disrupted. Now we know in Kenya, we know that we are landing a huge consignment of PPEs into this country. There is efforts to make sure that some of these parts are locally manufactured. But you must also remember that some of these PPEs for health workers are different from what you use if you are a sweeper in the hospital, or maybe you are just, you are out in the community. The health workers need N95 masks. We may have to import those. They need goggles. We may have to probably manufacture those locally or import them. So it's a mix of things. But yes, there has been a shortage, but I'm confident that that is being addressed. And it is important it's addressed because health workers are the frontline soldiers, must be protected.
Absolutely, Dr. Ari. Good point. Good point. Catherine Riungu is watching you from Komarok. She says, thank you for bringing Dr. Gitahi. I wish he could be on TV every day. And then Philip Jumbe says, could you ask Dr. Gitahi to stop touching his face?
Thank you. I need to adjust my specs every so often. But my hands are washed with soap all the time. But thank you for reminding me that.
Okay.
Very important information there. Another question in from Twitter, Sivenzia saying, kindly ask the doctor, what can one do right now to keep one's mental balance in check? Because the news from different media platforms concerning COVID-19 frighten some and cause anxiety. Very important question there.
It's a very important question. I would like to say something a friend of mine told me, say, there is no treatment for panic. There is only treatment for good decisions. We can actually decide what to do, and that's what we are advising people on what to do. Social distance, stay at home. If you can't stay at home or wherever you have to meet other people, keep at least 1.5 meters away from each individual. That's easy to do. We can make a choice about that. Thirdly, wash your hands with running water and soap all the time. And finally, if you're going to be a public place where you may, keeping social distance may not be, physical distance may not be very easy, or even to protect others in case you're coughing, wear a mask. So that's what we are saying. So if we follow those basic, rules, we shouldn't have to panic. But you have raised a very important question around mental support. And we have, within the National Task Force, that we have many partners, including AMREF, Red Cross, and others. The Red Cross has taken up the role of trying to support psychosocial support, because we know this is going to be difficult for us, each one of us, including some of us. Myself, I have had to talk to different people to support me. And I'm sure it's the same for the minister, for the people working in the Ministry of Health, for everyone working on this. It is extremely taxing on our minds. And therefore, we have psychosocial support available. Red Cross is providing that. But also remember, there are a lot of our brothers and sisters who are going to lose jobs, get pay cuts. So this is going to be extremely draining. So even as you talk about social distancing, it is more physical distancing. We must support each other through all the channels we can virtually, because we should not feel lonely, and we must continue to support each other. Most importantly, avoid fake news, avoid what we are calling infodemic, this deluge or false news or scary news. Avoid that. Just focus on facts that are given to you by medical professionals, by experts, by epidemiologists. And that is why we must appreciate the media for calling us every so often to talk to you so that you receive the right information and therefore we avoid panic.
Absolutely. Kelvin Gashima on Twitter is asking, how well can we differentiate COVID-19 from the common cold? Doctors might have tried to tell you how, but I have seen some people run away from others because of what we commonly called homa.
Well, let me address that. That number one is that the cough from COVID-19 and a cough from homa is exactly the same cough. So the only way is you may have somebody, let's first remember that majority of the people who have COVID-19 will have no symptoms, okay? So this is why don't watch for symptoms for you to take guard. Take guard before you see the symptoms from someone else. This is why we are saying, again, I'll repeat, social distancing. Stay home if you can. And staying home means don't stay home and then have parties of 100 people at your house or 50 people or 20 people. Stay home, because when you stay home, you protect yourself and protect others. Now, remember that you must wash your hands all the time. But that doesn't mean that now you have to only wash your hands when you have somebody who is coughing, because people who may transmit it to you may not actually be physically unwell. There's no way of telling the cough. But when somebody has moderate or severe disease, then we know that beyond the cough and beyond the fever, which some people may get, there is difficulty in breathing. That's why at some point, people are being advised that if you can hold your breath for more than 10 seconds, it's likely that you're okay. Well, there's no scientific evidence for that, but it's basically saying that for most people who have moderate or severe disease of COVID, they may have difficulty in breathing, but that may only be 2 out of 10 people. What about the other 8 who may have very mild symptoms like homa? So please protect yourself. Stay home, wash your hands with running water and soap, and when you're going to a public place, wear a mask.
Okay, this is a question about what happens post-recovery, Daktari, from Vet Kiarie saying, this goes to the doctor. Will people recovering from coronavirus remain carriers of the virus? I'm asking because birds suffering from infection bronchitis caused by the coronavirus remain carriers even after recovering.
Well, what we know from science is that when you get infected by coronavirus, COVID-19, there's a period your body fights it, and in many people it fights it and creates extinction for the virus in your body. And therefore that's why, even when we talk about recovery, remember when we say people have recovered, it doesn't mean they were sick. It means they were positive for the virus. There are many people who are positive for the virus. They are put in isolation. They don't actually develop symptoms. So they're not sick, but they have the virus. And then you wait, and over a period of time, you test again, and you find they're negative for the virus. That's what we call recovery. Now, that means that when you test for the virus, it's not present anymore in their body. So they're not carriers beyond the time they're negative, but they may get infected again like anyone else. The one thing that happens after you've had COVID-19, and as happens with many other viruses or antibiotics or bacterial infections, is your body develops what we call antibodies. Those antibodies are the bullets, or they are the ones that help you to fight, and they remain in your body, which means now your body knows how to fight this virus. And next time if you get contact with the same virus, your body produces these bullets faster, and therefore you may have a less chance of getting infected again. But they don't remain carriers of the virus. They just develop antibodies.
Doctor, we're going to take a little break. Do you have time to hang out with us? Are you busy? Are you cool?
This is important, Jeff. I'll be here.
Just appreciate that. And a lot of viewers are really enjoying.
A lot of concerns there.
Yeah, absolutely. A lot of questions, tweets coming in thick and fast. Dr. Githinji Gitahi is going to stay with us to answer a lot of your questions, including one by Michael Ayeko here. Why does COVID-19 infect more men than women? We'll talk more with Dr. Githinji Gitahi after the break. Sunday Live. We'll be back. Keep tweeting at Koinange Jeff.
At Vicky Rubadiri.
At Citizen TV Kenya. The hashtag is Sunday Live. Live.